We have talked many times here on the show about the growing awareness and demand, really, for mental health care services. It stands to reason the demand for workers in this industry is on par. In honor of Mental Health Awareness Month, we talk about mindfulness today and the pressing need for nurse practitioners in this essential role. So I would like to welcome in Roxanne Oliver and Amber Budd from Mount Carmel College of Nursing to share their insights with us today. So ladies, thank you both for being here.
Thank you for having us.
Thank you.
All right, I want to start by talking just about mindfulness really in general. And Amber, I'll talk to you about this. Just what exactly that means. What are we talking to people about when we say mindfulness?
Well, yes, I would be happy to talk about that. There are some misconceptions about mindfulness. I think a lot of people think it means clearing your mind of all of its thoughts. That's not exactly the true core of what mindfulness means. So mindfulness is more setting aside the time and the space for non-judgmental awareness. So yeah, being aware in the moment of like what's going on in your life and not having any expectations about your life and just letting go of that and being aware of this moment and this time and just being accepting of where you are.
That is interesting because you're right. Even when you were saying most people think mindfulness is X, I was with you, like thinking like, yeah, that is what it is. So to look at it a bit of a different perspective probably is eye-opening even to the people that walk in to talk with you, isn't it?
100%, yes. And that's usually why I start my mindfulness sessions. I explain what it means because I think people come in with a preconceived notion
about it. Okay, so learning how to be present, you've done interventions, I know, that talk about kind of the effectiveness of this practice. So what did you learn through that study? What do you think we should learn from that?
Well, I mean, I learned a lot. What I did in my doctoral work was working with undergraduate nursing students to decrease their stress. So we did 4 mindfulness interventions. We did mindful eating, mindful breathing, mindful meditation, and a guided imagery to try to help reduce their stress. And we measured their stress with the perceived stress scale, which is a validated tool, pre and post intervention. So we found after the 4 interventions that their stress actually decreased by 13%. So there was a decrease in stress.
Yeah, a measurable decrease, which is probably what you look for then, Roxanne. We talk about this need for more people to find help in this field, which means we need more health professionals as well. So talk to us about that and the growing demand for those nurses.
Yeah, most definitely. It's unfortunate, but if you have a mental health crisis, you are going to be waiting a while to have that follow-up care because there's just not enough providers. So psychiatric mental health nurse practitioners, or PMHNPs, are crucial right now because they not only prescribe medication and manage those medications, but they offer treatment like this mindfulness and other modalities that looks at the patient from a holistic view. And so it's not just about the medications, but it's about living their best life mentally, emotionally, and physically. And nurse practitioners are perfect for that.
So Mount Carmel College of Nursing, you have a program for this. How does that work?
Yeah, so we have a traditional master's program where at the end of it, they can get certified as a psychiatric mental health nurse practitioner. We also have a post-grad certificate program. So the post-grad certificate is dependent on their previous educational experience. The traditional, it's an 18-month program, completely online. They have one immersion where they get to meet their wonderful faculty, and we can walk alongside them in their educational journey.
And Amber, is mindfulness kind of integrated into that training, into that field of work? Are they exposed to that before they get kind of out into the field and have to practice that?
Absolutely. So while they're in the program, they learn about mindfulness-based stress reduction, which is a specific type of mindfulness program.
Okay.
And they leave the program with a certificate in mindfulness-based stress reduction. So hopefully they can integrate that into their practice and into their personal life.
What kind of success are you seeing out in the real world with treating people in that realm, in that mindfulness, and kind of opening up their mind to that? What kind of success are you seeing with people?
I mean, I personally use it in my practice with my patients. I have a little mindfulness modules that I set up for them. And personally, I've seen it pretty effective with anxiety, stress levels, and just high functioning individuals that struggle with perfectionism. kind of
Okay.
letting go of that perfectionism. I found it to be effective.
Yeah, that's great to hear. Okay, then if someone wants to learn more about this, about all the programs, how do they do that? How do they get started on this path?
Yeah, so the best thing for them to do is to go to our website. It's mccn.edu. There they can connect with an admissions advisor, and we can provide them with the information they need and answer all their questions to get them started.
Okay, perfect. The need is there, the demand. A lot of people also search for job stability, and this is one field that you will certainly find that. So we want people to consider this, consider a career in nursing for sure. mccn.edu. Thank you both for being here.
Thank you.
Thank you for having us.